The annual malaria report published by the World Health Organization has shown tremendous progress in malaria control in sub-Saharan Africa. The 2016 report found that in 2015, children and pregnant women obtained better access to effective preventive measures as well as diagnostic testing and life-saving treatments.
We have seen great progress, particularly in Africa. We have much better coverage of bed nets to population at risk. We have much better coverage with drugs to pregnant women to prevent malaria in that group. And thirdly, we have much better coverage of rapid diagnostic tests, capacity to diagnose to guide treatment to the sick patients.
Despite the current progress, at least 15 million pregnant women across the region are still in urgent need of protective treatment to keep their unborn children healthy.
We are making progress in coverage, but still we have in excess of 400,000 deaths every year. A child dies every 2 minutes. In excess of 200 million malaria cases. So the job is far from being completed. We need to be able to close the gap among still a significant percentage of people living in endemic areas that do not have access to our key malaria interventions.
Achieving sustained and sufficient funding for malaria control is becoming a serious problem. Despite a steep rise in global investment for malaria between 2000 and 2010, funding has since flatlined.
If we want to achieve the goals that the world community has agreed upon, funding becomes critical. The last 5 years, we have seen no increase on the level of funding, be this from international donors or domestic funding from the affected countries themselves. We are not on track to achieve our goals unless we increase the amount of resources made available to the fight against malaria.
Malaria continues to affect 97 countries around the world. Sub-Saharan Africa carries a disproportionately high share of the global malaria burden. Last year, the Democratic Republic of Congo and Nigeria accounted for over 40% of malaria deaths on the continent. Celestine Carone, CCTV.